Welcome to this explainer. Today, we're taking some pretty complex health topics and transforming them into clear, actionable knowledge so you can take proactive control of your well-being. Think about it. Your body is essentially a highly complex machine, right? And just like any machine, it literally requires proper care and regular maintenance to function at its absolute best. We're grounding our entire analysis today in the comprehensive guide, Checkups for Health by Serenity Tanner. This is a fantastic resource because it visually maps out your roadmap to essential health screenings and preventative measures.
Here's what we're covering today. The power of prevention, essential physical screenings, prioritizing mental health, navigating medical jargon, overcoming healthcare barriers, and finally, taking action for your health. Let's jump right in.
Section 1. The power of prevention. So, preventive care. It isn't just about dragging yourself to the doctor when you already feel terrible. It's a proactive tool. We're talking about regular checkups, screenings, and tests specifically designed to catch health problems early. The whole goal here is to manage conditions before the symptoms even show up. And honestly, doing this saves you from astronomically expensive treatments down the line, and more importantly, it dramatically improves your quality of life and your peace of mind.
Section 2. Essential physical screenings.
Now let's look at something often called the silent killer, high blood pressure. A normal blood pressure reading is under 120/80. But if your reading hits 140/90 or higher, you've crossed into high blood pressure territory. And that's a big deal. It dangerously elevates your risk for heart attacks, strokes, and kidney damage. And the scary part is it often does all of this without a single warning symptom.
That exact same preventative logic applies to your cholesterol too. A simple fasting blood test measures these numbers, and here's what you're looking for. Your goal is a total cholesterol under 200. You want to keep your LDL, that's the bad cholesterol that causes arterial plaque buildup, you want to keep that low. Meanwhile, you want your HDL, the good cholesterol, to be high. If you catch these numbers early, you can make really simple lifestyle adjustments way before a crisis hits. And as we age, our preventative needs naturally evolve. Think of it chronologically. Kids need vaccines and vision exams to ensure proper development. Then young adults shift toward things like STD testing and skin exams. As we hit middle age, we require more targeted checks like colonoscopies and mammograms to screen for cancers. And eventually, for seniors, the focus transitions to maintaining mobility and cognition through bone density and memory screenings.
Section 3. Prioritizing mental health.
You know, just like our physical bodies, or hey, even our cars, our minds require routine care and tune-ups. It's so crucial. Regular mental health screenings help catch conditions like anxiety and mood disorders really early. And these screenings don't just lead to early treatment. They literally improve your daily quality of life, they normalize the conversation, which heavily reduces the stigma, and they increase your own mental health literacy so you can actually understand what you need to thrive. If you find this analysis valuable, please like and subscribe to Knowledge Lighthouse to help us bring more truths to light.
Section 4. Navigating medical jargon.
Okay, medical jargon can be super intimidating, right? But you can actually decode these terms just by breaking them down step by step. Take a scary-sounding word like cardiomyopathy. Let's break it apart. Cardio means heart, myo means muscle, and pathy means disease. Put it all together, and it simply translates to a disease of the heart muscle. See? Suddenly it's not a mystery anymore. The source text really hits the nail on the head here regarding medical reports. Understanding the basics of your lab results, like knowing that a CBC measures your blood cells or that a urinalysis checks your kidney function, it totally empowers you. It allows you to sit down and have clear, confident conversations with your healthcare provider instead of just nodding along and hoping for the best.
Section 5. Overcoming healthcare barriers.
Now, we have to acknowledge that financial constraints and access issues are very real, but they can be systematically dismantled. There are some truly excellent strategies available to you. For instance, the Affordable Care Act mandates coverage for a lot of preventive services without copays. Plus, there are robust government programs like Medicaid and SIP, free or sliding-scale community clinics, and incredibly convenient telehealth services that bring the doctor directly to your living room. But what if the barrier isn't financial at all? What if, honestly, anxiety is what's keeping you from the doctor's office? If the fear of a bad diagnosis or a medical procedure is holding you back, you're definitely not alone. Educating yourself about what to expect, practicing deep breathing or meditation, or even just bringing a trusted friend or family member for support can be game changers. You really can transform a scary visit into an empowering one.
Section 6. Taking action for your health.
Having all this information mapped out online is great, but having it sitting right there on your shelf as a constant physical reference is even better. For the complete deep dive, own the paperback. Get your high-quality paperback edition on Amazon via the link in the description. Add it to your collection today. Please share this video and check the description for more.
Right now, we are looking at an absolutely incredible future of personalized medicine, a future where treatments are tailored to your unique genetic makeup and your specific lifestyle. But here's the thing, all the medical advancements in the world can't help if you don't show up. So, I'll leave you with this. What is the one proactive step you've been putting off, and what are you going to do about it today? Thank you so much for exploring this vital topic with us.